am going to be presenting my design project 3 for Hlsa 484. So before going into details about the issue my user faces, I want to discuss the 4 aspects of the innovation arc and how it relates to how we might help my user and other users. The first step in the innovation arc is to identify the user, who they are, what they do, and what they need from the community. Second, we have to find out what aspects of their life are not so great. We need to find out what they're lacking and how we can better help them. Then we shift our focus onto finding a solution to the issue that this person has described. This may be abstract, or it also may be a concrete solution. It can be either, but it is crucial to always think about what the user would want, not what we would want. So always keep the user in mind. The last part of the innovation arc is impact. So that's when we evaluate the impact of our solution on an individual level for a particular user, and also on a more broad level of the entire community. So let's first describe the person I spoke with and what she does for a living. This is who I'm attempting to help develop a solution to and try to fix the issues that she faces challenges every day. So my particular user is an African-American female living in Temple Hills, Maryland. She works in a salon full-time as a hairstylist and was braiding hair while being interviewed. She enjoys being a hairstylist, but she really does wish that the pay was better. She commented that she is barely making it by, and you'll realize this more throughout the presentation. And throughout the interview, multiple barriers in various aspects of her daily life were mentioned. At times, it was very clear that these barriers represented health disparities and were emotional. They affected her emotionally. At a few times, she actually teared up. Her eyes got very glossy. So you could tell that these were very personal and emotional issues to her. So now that I've described the user and what she does for a living, let's dive into her needs. Let's dive into the user's needs and what she faces, the challenges she faces on a daily basis. So my particular user, like I said, is a female hairstylist at a salon in Temple Hills, and it's important to note that she did not have health care because she cannot afford it. Alone, though, as almost 12% of people under 65 do not have health care in Temple Hills, so that's actually a large chunk of people, believe it or not. It's only 12%, but for 12% of people not to have health care, that's kind of significant. And this lack of health care represents the health disparity and the social determinants of health that are obviously present in Temple Hills. And when speaking about this, like I said before, it was clearly a very emotional subject for her. Another one of her issues that she discussed, which was access to healthy food. She mentioned that the main reason she cannot access healthy food was due to the expense of it. Healthy food is often, or almost always, more expensive, so she just could not afford it on her salary. And additionally, markets that were affordable were not in the area, so she was forced to either continue buying unhealthy foods from the markets in her area, or forced to travel far distances to places that had healthy food for a reasonable price. In order for her to purchase healthy foods at an affordable price, she would actually have to drive to the African Food and International Market, which is located all the way in DC. So not only was she commuting, she was spending gas money going there and coming back, just because there was no available options in her area in Temple Hills for her to get affordable food that were healthy. And she's able to purchase bulk food at this market. However, like I said, she is forced to drive the distance in order to obtain these healthy foods at an affordable price. And this very clearly represents the lack of healthy and affordable food choices available to all residents living in Temple Hill. So now that I've gone over the issues that she faces on a daily basis, I'm going to talk about how I might help her access healthy food and produce with ease. And how might we bring nutrition and healthy food options to her neighborhood so that she doesn't have to drive all the way to DC just to purchase affordable and healthy food. I'll also discuss how I might help my user become more involved in her own health and wellness through access to healthcare. I wonder if educating her on various resources available in the healthcare industry might help her obtain health insurance. And since health and diet are so interconnected, it's very important to approach and address both issues with the same level of significance. I'm also proposing the implementation of a nutrition program which will provide residents with information and incentives to shop healthy. So on this slide, I'm going to outline the basics of the nutrition plan I developed. So the USDA provides recommendations for healthy meals, yet many people don't have access to this information or don't even know that it exists. So for those in Temple Hill, it is essential for all residents to understand what composes a healthy meal. This is why I propose to provide USDA flyers in each grocery store as you enter, so that residents have access to this information and are able to use it to make sure they're getting adequate nutrition. You can see the background here shows you what you need on every meal: vegetables, protein, fruits, and grains. And it shows the servings. And so the flyer would just be pretty much a guide of what you need in your daily meals to remain nutritious. Another aspect of this nutrition program is for low-income individuals, which involves receiving every 4th purchase of fruits or vegetables free. And this would incentivize people to buy more fruit and vegetables and help them financially as well. And a point system would also be in place, so each time that you purchase healthy foods like vegetables, fruits, other healthy options, you get points which can later be redeemed, if you have enough, for even more healthy foods. And then also throughout the stores there would be yellow tags indicating the healthier food choices on the shelves. They would be set apart from the less healthy choices. During the interview, she was asked if she would be interested in purchasing fruits and vegetables from a local community-based garden, and she said that as long as the prices were reasonable and affordable and was within the area, she didn't have to drive very far, that she would be more than happy to engage in buying fruits and vegetables from a community garden. However, no such community garden exists currently in Temple Hills. And so that's why I think community gardens would significantly benefit my user and also many other residents of Temple Hill. Due to the lack of fresh fruit and vegetables. So due to the lack of fresh fruit and vegetables available in Temple Hills, I want to provide the opportunity for residents to participate in gardening themselves. Not only does this ensure access to healthy food, but it provides them with food free of charge. Fruits and vegetables would now be accessible and affordable, and they know that it's homegrown, it's safe, and it's readily accessible to them. This would also engage the community. Community members would be more involved and get to know each other, and this could lead to further advancements in the community in terms of attracting more markets, or even if enough members of the community rallied up and started a food co-op or something like that, which would be of even greater benefit, but the community garden would definitely be a start. And in order to attract people to that, there would be newsletters and flyers that would be posted and given to residents to keep the community in touch, involved and up to date on the gardening initiative, and this would also encourage the community participation and keep resources within Temple Hills, because that's what they really need. Temple Hills needs resources for themselves. Another convenient platform that I would provide for my user is the ability to access medical services on the go through mobile health centers like this one. So mobile health offers health services that would be offered in any clinical setting, except for it can travel to different areas of the community and offers quick and reliable diagnostic services. Mobile health would provide an opportunity for residents to get a quick, free checkup without having to spend time sitting in a clinic waiting room. It is very convenient, and it would travel to different parts of Temple Hill, which would ensure that all residents of all parts of Temple Hill would get the opportunity to access the services of mobile health. And I think this specifically would be super important and beneficial, because not everyone, some people have disabilities to where they cannot travel very far distances, and just having access to mobile health would be very beneficial to people like that. Also, feedback from the community plays a crucial role in patterns of disease and healthcare access. So this is why surveys and focus groups are important to community health. So I propose that medical surveys be sent to residents in Temple Hills, which would collect information based on their background, their attitude towards healthcare and medical services, their daily health practices, the social barriers they face to health accessibility, and the knowledge that they have about their own personal health, so the insight that they have about their own personal health. So routine monitoring to measure illness, immunization records, child wellness, and insurance coverage will also be assessed, and this will ultimately help target at-risk individuals, so high-risk individuals, and manage disease outbreak. So those determined high risk will be offered a free clinical evaluation to determine if they have a serious health condition that requires medical or prescription treatment. And again, all services will be provided free of cost, so the residents of Temple Hills and people like my user would not have to worry or fret about how they're going to pay for it. Another aspect that involves the community and community feedback is focus groups. And basically, it's a more broad aspect of health in the community, and it's going to be addressed with focuses on specific health issues, feedback from the community, and the most prevalent and difficult barriers to accessing healthcare. And I think this is very important because we're receiving feedback directly from the community members who live and suffer from these health disparities and challenges and barriers every day. And lastly, telling my user and all Temple Hill residents really about the Susan D. Mona Center will be one of the most transformative interventions out of all those that I've discussed so far. So informing all residents about the services provided at the Mona Center is essential to their health. Letting residents know that primary health care, dental care, and behavioral health services are provided at low or no cost will elevate so many lives within the community. In addition, the Mona Center has a farmer's market, a teaching kitchen, an exercise room, and a teaching healing community garden. And all of these services can allow residents to access food, exercise, and much more that they were not able to do before, or they had to go through extensive measures to access these same services. My user, who has no insurance and has trouble accessing healthy foods, would highly benefit from the services that the Mona Center has to offer, and no longer would have to drive all the way to Washington, D.C. To the African and international market to purchase healthy and fresh food, because this is provided at the Susan D. Mona Center. Finally, I will briefly discuss the impact these services that I discussed will have on my user, and then the impact it will have on the community as a whole. Each solution and focus throughout this presentation was specifically tailored to my user, but they can, and they most likely will, be able to benefit a lot of the residents in Temple Hill as well. My user, the hairstylist, she expressed the concern with accessing healthy food and then not having health insurance. So the impact on my user that my interventions would have is that she will be able to choose from any of the health services I mentioned and have access to health care via Medicaid or through the Mona Center. In addition, she can choose to become involved in the community gardening program and also become more informed and aware about healthy food options. On a more broader scale, it would impact the community as a whole because residents of Temple Hill may be more aware of government programs that can assist them in achieving better health and affording healthier foods, such as Medicaid and the SNAP program. And the Mona Center can also positively impact the entire community as it provides services for almost anyone.